Hi, everyone, and welcome to today's presentation on the diagnosis of autism spectrum disorder, or ASD, by Carson Kitts. We will talk about what autism spectrum disorder is and the process of diagnosing ASD, the common signs and symptoms, the importance of early diagnosis, common challenges individuals with ASD may experience, an overview of therapy services, and available caregiver resources. Autism spectrum disorder is a neurodevelopmental condition characterized by deficits in social communication and the presence of repetitive and restrictive behaviors. The term spectrum reflects the range of abilities and difficulties individuals with ASD may have, with varying levels of severity. ASD is diagnosed through a comprehensive evaluation performed by a multidisciplinary team of specialists in developmental disorders. These professionals may include developmental pediatricians, psychiatrists, and neurologists. The process to diagnose typically involves the diagnostic observation schedule, which includes a structured observation of behavior. Additionally, the autism diagnostic interview may be used, and this is a semi-structured interview to gather information on behavior and developmental history. Diagnosing ASD usually occurs between the ages of 18 months and 24 months. However, there are rare scenarios where individuals may not be diagnosed until adolescence or adulthood. Signs and symptoms of autism spectrum disorder typically begin to appear around the age of 2. However, they can be identified earlier. Some common characteristics may include displaying repetitive behaviors or engaging in repetitive activities, resistance to adapting to change in a routine or within the environment, unusual responses to sensory input. Additionally, individuals with ASD may also have difficulty or avoid making eye contact, not respond to their name, show limited facial expressions, struggle with interactive play, show limited interest in sharing experiences or interacting with others. Overall, it's important to remember that each individual with ASD is unique and the severity and symptoms can vary. Early diagnosis of ASD is important as it provides individuals with access to the resources, interventions, and support they need as early as possible. Early identification allows individuals to have access to therapies that will focus on improving developmental outcomes, communication skills, and adaptive behaviors. By accessing these services and support systems early on, individuals with ASD will have more opportunities to build life skills, gain independence, and improve their well-being. Overall, individuals with ASD may present differently and often experience unique challenges based on individual abilities, external factors, and the level of support they receive. Some common difficulties that may arise in daily activities include daily living skills. This includes tasks such as dressing, eating, and personal hygiene. Individuals may also experience difficulties with instrumental activities of daily living or tasks such as finances, cooking, and transportation. Health management is another area, such as medication management, physical and mental health routines. Many individuals with ASD also experience difficulties with sleep, often experiencing difficulty with sleep patterns. Play and leisure may be difficult due to challenges in social interaction, having restricted interests, or sensory sensitivities that impact participation. Social participation can also be difficult, specifically building and maintaining social relationships. Understanding these areas help to better support individuals with ASD in gaining independence and quality of life. Individuals with ASD may benefit from a variety of services. This includes occupational therapy, which may address fine motor skills, sensory processing, social participation, and adaptive behaviors. The main focus is to help individuals improve performance and independence in daily activities. Physical therapy may also be a beneficial service. They may address gross motor skills, coordination, and physical development to improve mobility and functioning. Speech therapy may be beneficial as they will target communication skills, speech development, and social interaction difficulties. They also may assist with verbal and nonverbal individuals. Communication. Applied behavior analysis, also known as ABA, is a common approach that may be used to help improve social and behavioral skills. Lastly, early intervention programs are beneficial as these programs are focused on providing support in early stages of development. If you suspect an individual may present with signs and symptoms similar to those of ASD, it is recommended to seek an evaluation. Families and caregivers can access local support groups to build a community with those who have similar experiences while caring for someone with ASD. Additionally, parent training programs are available to educate families on strategies that can be used to support those with ASD. Let's review what we've covered today. ASD is a neurodevelopmental condition characterized by deficits in social communication and the presence of repetitive and restrictive behaviors. A diagnosis can be made through a comprehensive evaluation by a team of specialists such as developmental pediatricians, psychiatrists, and neurologists. Typically, therapy services include occupational therapy, physical therapy, speech therapy, ABA, and early intervention. Caregivers can access support groups, training programs, and parent training groups to help manage the challenges of caring for someone with ASD. Please always seek the advice of your medical team before implementing any of the strategies discussed here. Thank you all.